Ako po si Nermito Mugso, nurse po dito sa Mahayag Municipal Hospital, a hearing screener. May gagawin po ako ngayon sa inyong baby po, hearing screening na Otoacoustic emissions. Kayo po ba ang nanay ni Ana Ramirez Silvestri? Okay po ma'am, mag-start na po ito ngayon sa procedure. The brand and model of this device is NeuroSoap AudioSmart from Everyday Enterprise. Visually check both ears of the patient. Choose a probe that is appropriate for your patient's ear. Gently pull the pinna backwards and downwards. Insert the probe with a gentle motion and obtain good seal before starting the test. Save and print the results of the patients. Choose a probe that is appropriate for your patient's ear. Gently pull the pinna backwards and downwards. Inserted the probe with a gentle motion and obtained good cell before starting the test. Perform the test on the other ear. Save and print the results of the patients. Dispose gloves and sanitize room.
Part 2, question and answer. No staff criteria for inpatient. Question number 1. Describe staff criteria for inpatient screening. Please discuss the staff criteria for inpatient Otoacoustic emission screening. The inpatient OAE screening protocol can have as much as 2 sessions. In each session has maximum of 3 trials each. If the baby air passed on the first session, first trial, then the final result for that year is a pass. If that ear refers or fails, then a second trial is performed. If that result is a pass, then the final result for that ear is a pass. If it is a refer, then a third trial is performed. If the result is a pass, then the final result is a pass. If it is a refer, then the baby is allowed to rest for several hours.
No staff criteria for inpatient screening. Question number 2. Describe criteria for follow-up or second session inpatient screening.
And a second session started following the same procedure as for the first session. If the final result is a pass, then the nurse is given the appropriate advice. If the final result after the second session is a refer, then the baby may have to be referred to his or her physician, may perform additional tests and procedures, after which outpatient hearing screening is done. No staff criteria for outpatient. Question number 2. Describe the staff criteria for outpatient screening. The outpatient staff criteria for Otoacoustic emission is similar to the inpatient staff criteria, except that there is only one session, and if the result is a pass, only during the third trial, which means that the first and second trial were both a refer or a fail, then a fourth trial is done. If the result is a pass, then the final outpatient OAE result is a pass, but if it is a refer or fail, then the final result is a refer.
Knows how to give advice parent or guardian. Question number 1. How will you explain to the parent a pass result at the first session inpatient screening of the baby without risk factor?
Congratulations po, Mami. Pasada po ang hearing screening ni Bibi. Bibigyan ko po kayo nitong guide. Basahin po sa bahay. Nakalagay dito ang developmental milestones para mamantayan natin ang development ni Bibi. Nakalagay po dito, pag isang taon siya, masasabi po ng mama at papa. Thank you.
Questions number 2 for knows how to give advice to parent guardian. How will you explain to the parent a refer result in the first session inpatient screening of the baby?
Mami, refer po ang result ng newborn hearing screening ni Bibi. Kailangan yung mabalik dito sa amin makalipas ng 2 oras. Ulitin po natin ang test. Salamat.
Questions number 3 for knows how to give advice to parent guardian. How will you explain to the parent a refer result in the second session inpatient screening of the baby?
Mami, ang resulta po ng 2 nating screening ay refer. Ngayon po, ayon sa protocol ng hearing screening, kailangan po natin bumalik after 2 weeks bago mag-1 buwan. Ulit natin yung test para masigurado natin na refer talaga ang resulta. Ito po ang brochure natin na may developmental milestones para mabantayan natin ang development ni baby. Salamat po!
Questions number 4 for knows how to give advice to parent guardian. How will you explain to the parent a past result in the second session in patient screening of the baby with risk factors?
Congratulations, Mami! Pasado po ang hearing screening ni baby. Bibigyan ko po kayo ng guide, basahin po niyo sa bahay. Nakalagay dito yung developmental milestones. Nakalagay po dito dapat pag isang taon siya, magsasabi po siya ng mama at papa. Kung ang baby mo, pasado po sa hearing screening na meron po kadahilanan ng peligro na mawala ng pandinig, ang iyong baby po, babantayan niyo at regular follow-up check-up po sa inyong doktor. Salamat po!
Questions number 5 for knows how to give advice to parent guardian. How will you explain to the parent a refer result on outpatient screening?
Mami, ang final result po natin ngayon ay refer. Mainam po nga pumunta tayo sa doktor natin para ma-request natin ang confirmatory test. Dito, malalaman natin ang grado ng paningin ni baby. Para malaman natin ang dapat gawin, ito po ang aming contact number na kung may katanungan kayo patungkol sa newborn hearing. Salamat po!
Questions number 6. After reaching a final refer result, how will you handle a parent who wants you to repeat the screening procedure?
Mami, ang final result po natin ngayon ay refer. Mainam po mapumunta tayo sa ating doktor para ma-request natin ang confirmatory test. Dito, malalaman natin ang grado ng pandinig ni baby. Para malaman natin ang dapat gawin, ito po ang aming contact number. Kung may katanungan kayo patungkol sa newborn hearing screening. Yun lamang po. Salamat po.